Good day, and welcome to the Government House Weekly Press Briefing and COVID-19 update for the week of May 16th, 2022. For the benefit of the radio listening audience, I am Government House Communications Director Richard Mota. Joining me this afternoon is Health Commissioner Justa Encarnacion for the latest COVID-19 data and information on where Virgin Islands residents can get a COVID-19 test, vaccine, and booster shot this week. But before we go to the Commissioner, it is graduation season in the U.S. Virgin Islands, and I want to take this opportunity now to congratulate all graduating this week and next, and also to wish you all nothing but success in your future endeavors. For a full schedule of dates and times of the graduations for our territory's public education institutions, visit the Department of Education's website at vide.vi. Again, that's vide.vi. You can also watch the graduation ceremonies live on the department's Facebook page, as well as on the Government Access Channel, which is Channel 27, if you have VIA. So all of those graduation ceremonies will be made available virtually for the public to watch who cannot attend in person, and they will also be available on the Government Access Channel, which is Channel 27, if you have VIA. I will turn over the briefing to Commissioner Encarnacion at this time. Commissioner?
Thank you, Director Mota, and good afternoon, Virgin Islanders, and congratulations to all graduates. Today we have 901 active COVID-19 cases, and our positivity rate is 14.92%. There are currently 16 COVID-19 positive patients hospitalized. One F. Louis Hospital Medical Center has 5 patients with 1 ventilated, and Schneider Regional Medical Center has 11 patients with 1 ventilated. It was confirmed that both ventilated episodes are not COVID-related, but rather linked to other comorbid conditions. There are 362 active cases on St. Croix, 518 on St. Thomas, and 21 on St. John. According to the latest data, St. Croix's fully vaccinated rate is 43.98%, St. Thomas 46.52%, and St. John 73.36%. Overall, the territorial vaccination rate is 54.41%. Our 7-day positive rate, like we said, is 42.92%. You still have time to be vaccinated. We now need to shift our thinking towards self-monitoring. Each of us in the best position, we are all in the best position to do the right thing in the situation that we're in. For example, when in a crowded public area where we will be having a lot of crowded events coming up, please wear your mask and try to social distance. We are transitioning from a pandemic to an endemic phase. Let me explain a little about what that means and how it relates to self-monitoring. Basically, it's self-monitoring and self-accountability. In an endemic phase, a virus like COVID-19 will always be circulating among us in some form, much like the flu or common cold. Thus, some portions of the population will always be positive for infections, whether they know it or not. Right now, while our numbers are high and transmission is likely, the department is asking everyone to become vigilant about self-monitoring and respond appropriately with mask wear and social distancing when in unsafe, crowded surroundings. Please become part of the community-wide solution by doing everything to keep yourself safe and healthy. Getting vaccinated and boosted, wearing a mask, socially distancing, and frequent hand washing is what self-monitoring is all about. It's evaluating your situation and reducing your risk. The decisions you make about your environment are equally important as those you make about becoming vaccinated. And yes, vaccines are still available, as I said, and testing once you feel sick. As we continue the road to endemicity, last week the department shared with you our decision to align our precautionary recommendations for isolation and quarantine with the CDC's recommendations. These recommendations include If found COVID-19 positive by a viral test, you must isolate despite your vaccination status. Further, everyone with a positive test is to isolate for at least 5 full days and remain isolated until you are feeling better and no longer with symptoms. If you have been fever-free for 24 hours without the use of a fever-reducing medication like Tylenol, if you have been fever-free, like I said, you may end isolation after that 5 days. Take precautions for a complete 10 days and wear a mask for the entire 10-day period, especially if you have to be around someone who is immunocompromised. You do not have to repeat a test after ending isolation. Remember, we look at COVID-19 in terms of the length of time and that separation in which the viral load reduces and you're no longer infectious versus whether or not you are testing negative when you come out of isolation. The chances of you testing positive is still likely because of that COVID or that viral shedding that we spoke about several months ago. Quarantining is for anyone exposed to a positive COVID-19 case and has 3 distinct categories. If you are not up to date on COVID-19 vaccines, you should quarantine for 5 days, wear a mask at home and while around others, watch for symptoms for 10 days, and wear a mask for the entire 10 days regardless of the presence of symptoms. Everyone in the group should get tested on day 5 from their exposure, even if symptoms do not develop. If you are up to date on COVID-19 vaccines, meaning that you have been vaccinated and boosted, no quarantine is needed unless symptoms exist. Everyone in this group should get tested on day 5 for their exposure, even if symptoms do not develop. A well-fitted mask should be worn for 10 days from the exposure date. If you had a confirmed case of COVID-19 within the past 90 days, no quarantine is needed unless symptoms develop. Watch for symptoms until day 10 and wear a well-fitted mask for the 10-day period. Again, we urge persons coming out of isolation or quarantine to avoid persons who are immunocompromised or high risk for severe illness from COVID-19. Home testing. Positive test results from a home COVID-19 test should be confirmed. Confirmation is absolutely necessary if medical therapeutic treatment with an oral antiviral or monoclonal antibodies are to be prescribed. Confirmation testing can be arranged by telephoning the COVID-19 hotline at 340-712-6299 or 340-776-1519. And I'll repeat them. 340-712-6299 or 340-776-1519. The hotline is open Monday through Friday between 8 a.m. and 5 o'clock p.m. To pre-register for testing, please visit www.covid19usvi.com/testing. With respect to the incentive cards that we ran out of during our last vaccine booster promotion, we are working with the Department of Finance and our financial institution to get the cards to you as soon as possible, and we will inform you when the distribution of these cards resume. And now for a few reminders. The community vaccination centers on St. Croix will remain open for you to get your first doses or your boosters, and of course that at the Charles Howard Complex. Appointments are encouraged in St. Croix, especially due to the new, smaller location, as I said, at the Charles Howard Memorial Complex. You can call 340-777-8227 or visit covid19usvi.com/vaccine. In St. Thomas is at the 2nd floor of the Roy Lester Schneider Hospital. And of course, in St. John is at the Virginia Sports Authority gravel lot, and that is every Wednesday from 9 a.m. to 1 p.m. If you test positive with a home test kit, and this is a reminder, please immediately quarantine and obtain a confirmation test at a lab provider or the Department of Health testing drive-through to become eligible for COVID-19 therapeutic, oral, antiviral, or monoclonal antibodies. You're eligible for these life-saving treatments regardless of vaccination status. And that also is very important because you heard our vaccination rates are very low. We have opened it quite a bit. The exposure is there. We're asking you to be safe. However, if you contract COVID, especially if you meet that criteria, please call, make an appointment, get your antivirals. It's accessible at the emergency room. It's also accessible at your physician office that can be prescribed. Dr. Hunt Caesar is also working closely with all the pharmacists as well as the providers to ensure that the process is a smooth process and everyone who is requiring antivirals receive them. For the latest COVID-19 information, visit the U.S. Virginia Department of Health Facebook page or our website, www.covid19usvi.com. And for COVID-19 health information, alerts, text COVID-19 USVI to 888-777. In closing, the decision was made to reduce our restrictions because of the need to balance our behavioral health and financial resources with our physiological health, as we have been committed to from the beginning of the pandemic. However, if we begin to see severe illness with an increased number of hospitalizations, we will have to reintroduce the mandates. We don't want to do that. To prevent this, we need your help. Stay well, stay safe, stay healthy. God bless you. Thank you, Director.
Thank you, Commissioner. In other news, Governor Bryan is scheduled to testify before the U.S. House of Representatives Committee on Natural Resources virtually this Wednesday at 10 a.m., where the governor is expected to brief the committee on the state of the territory, our territory's priorities for 2022, and President Biden's fiscal year 2023 budget requests. The hearing will be live streamed on the committee's YouTube page. So if you go to YouTube and you just search for Natural Resources Dems, that you'll be able to find their YouTube channel there. So again, that's www.youtube.com/user/Natural Resources Dems. We will also have coverage of the governor's briefing before the House committee tomorrow, on Wednesday, on the Government House's Facebook page as well. In closing this afternoon, it is National Police Week, and I want to encourage all Virgin Islanders to take some time this week to show your appreciation for our law enforcement officers and peace officers. Thank you all for keeping our community safe. I also want to take this time to wish our emergency medical service personnel a happy EMS week, and similarly, thank you to all of you, to the EMTs, the paramedics, for continuously rising to the challenge to help save and improve lives in our communities. That concludes our briefing this afternoon, short and sweet. I don't know if we have any questions from the media. I haven't been signaled that we have any media joining us virtually this afternoon. So with that, I would just like to say, wear your mask where required, and get the booster and get the vaccine and the booster shot now that they are available. Have a good afternoon. Thank you.